welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news.
Medical councils are empowered to impose any punishment on doctor for professional misconduct as deemed necessary. The Delhi High Court bench recently stated that such punishment may also include the removal of the name of the concerned doctor from the rolls of the register of the Medical Council permanently or for a specified. The Delhi High Court bench of Justice Subramanian Prasad made this observation while referring to Section 8.2 of the Indian Medical Council Regulations 2002. It states that 8.2 it is made clear that any complaint with regard to professional misconduct can be brought before the appropriate medical council for disciplinary action. Upon receipt of any complaint professional misconduct, the appropriate medical council would hold an inquiry and give opportunity to the registered medical practitioner to be heard in person or by pleader. If the medical practitioner is found to be guilty of committing professional misconduct, the appropriate medical council may award such punishment as deemed necessary or may direct the removal altogether or for a specified period from the register of the name of the delinquent registered practitioner. Deletion from the register shall be widely publicized in local press as well as in the publications of different medical associations, societies, or bodies.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Travel health clinic inaugurated in AIIMS, Bhubaneswar. A travel health clinic, the first of its kind in Orissa and among the very few in the country, was inaugurated at AIIMS Bhubaneswar on Monday. The new clinic will provide travel-related health advice to people who will undertake international journeys in the near future. It will function twice a week and provide imminent travelers essential vaccination service, including some country-specific vaccines like yellow fever vaccine, and provide advice about healthy behavior during foreign travel. It will also guide such travelers to assemble a customized medical kit for use in emergencies. Inaugurating the clinic along with Medical Superintendent Dilip Kumar Parida, AIIMS Bhubaneswar Executive Director Ashutosh Biswas asked international travelers from the state to seek travel-related health advice before embarking on their journeys to avoid contracting and transmitting illness beyond national frontiers. The State Immunization Officer Tapas Patra said this clinic will help to prevent the spread of foreign infectious agents through passengers who are not aware of their existence. Wegovy's heart benefits due to more than weight loss, Novo says. Novo presented groundbreaking data at the American Heart Association meeting, shedding light on the multifaceted cardiovascular benefits of its obesity treatment Wegovy. Contrary to conventional understanding that the drug's efficacy is solely linked to weight loss, findings from the select trial unveiled broader positive impacts on heart health. Earlier data from the trial released in August had already shown that Wegovy, scientifically known as semaglutide, reduced the incidence of heart attacks, strokes, and deaths from heart disease by 20%, in addition to facilitating an average weight loss of 15% in patients. The comprehensive results, now published in the New England Journal of Medicine, emphasize that Wegovy's heart protective efforts were evident even before significant weight loss occurred. The study, which included overweight and obese patients with pre-existing heart disease but without diabetes, revealed a 28% reduction in non-fatal heart attacks, a 7% decrease in non-fatal strokes, and a 15% drop in heart-related deaths compared to a placebo. Notably, researchers highlighted that the cardiovascular protection afforded by Wegovy was not solely a consequence of weight loss, challenging conventional wisdom. The drug's impact on heart health was observed almost immediately after treatment initiation. The study's authors acknowledged that while the precise mechanisms behind semaglutide's cardiovascular benefits remain speculative, the drug consistently influences associated risk factors such as inflammation, blood pressure, and blood sugar control. China on alert for COVID relapse. Chinese experts have raised concerns about a potential resurgence of COVID-19 infections during the current winter season and have urged elderly and vulnerable populations to get vaccinated. The Chinese Center for Disease Control and Prevention reported 209 new severe COVID-19 cases. Renowned respiratory disease expert Zhong Nanshan cautioned about a possible small spike in COVID-19 cases during winter and emphasized the importance of vaccination, particularly for at high-risk groups. The virus is undergoing mutations and the general population's ability to combat the disease is diminishing as antibody levels decrease over time. He also highlighted the likelihood of an increase in COVID-19 cases during the winter, coupled with the traditionally high incidence of influenza during the season. He advised people to be cautious of potential co-infections.
That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.